Good evening. I will talk about evolution of the treatment of subacromial pathology. A quick review. The first description of rotator cuff tear was done in 1834 by Smith. And in 1867, Yarabai was the first to observe a morbid process in the subacromial bursa, who, on the basis of a few cases, gave general description of subacromial bursitis. Play in 1872 introduced the term periarthritis humeri scapularis, which is stiffness and pain, and he referred the cause to subacromial and subdeltoid bursa. In 1942, Peterson published observations on subacromial pathology. In the late 30s, then, Armstrong recognized impingement as a source of shoulder pain. It was thought to be against the lateral acromion. Complete acromiectomy procedure was recommended from Watson, Jones, Armstrong, and Hamann. The resection of the lateral three-fourths of the section of the lateral three-fourths of the acromion was then suggested by Smith Peterson in 1943. Then resection of the lateral one-third of the acromion was then suggested by McLaughlin in 44. So, general acromiectomy, all acromion resection procedures led to deltoid weakness, wound complication, and functional impairment. Some in 62 have suggested to shift the glenohumeral joint downwards by making a glenoid osteotomy so that to be away from the acromion to relieve impingement. Transacromial approach was described by Dubert to treat cuff tear without damaging the deltoid. It did not relieve impingement. In 1972, Neal described the impingement syndrome as extrinsic stenosis or compression of the space through which the supraspinatus tendon passes. And he advocated as extrinsic factors. And he described that impingement is comparison of the soft tissue against the anterior one-third of the acromion on shoulder elevation above 90 degrees in the arc of function. And he postulated that 95% of rotator cuff tears are due to outlet impingement. The supraspinatus outlet narrowing is due to anterior acromion spur causing impingement, as he stated. Supraspinatus outlet narrowing also can happen through increased slope of the acromion or AC joints osteophytes. In 1984, Bigliani presented a relation between the shape of the acromion and subacromial narrowing, and he divided that into three types: flat, curved, or hooked, which is mainly or mostly in hooked acromion. Now, in 1983, Neal presented his procedure of anterior acromioplasty to remove bone from the anterior acromion in order to establish a tunnel and free the rotator cuff from impingement. And the anterior acromioplasty was done through a wedge resection of the anterior acromion and the removing of the spurs from the acromioclavicular joint if present. And in case of a symptomatic AC joint, he will do a resection of the lateral end of the clavicle. In 85, Elhalawany presented the arthroscopic subacromial decompression by removing the wedge resection from a bone from the anterior acromion arthroscopically in order to widen the subacromial space. And other causes of impingement were described as loss of the suspensory mechanism in case of dislocation of the AC joint or a dynamic narrowing of the subacromial space. Variation of the cause of impingement syndrome and technique modification of the subacromial decompression is very important, and caution in the diagnosis of the impingement are recommended, as we will be seeing in this webinar. Thank you very much.